Did not even phase the pain.
In 2006, Tom Sanders developed intense unexplained leg pain. After seeing several doctors and trying many medications, he found a doctor who could help him.
My name is Dr. Sitzman. I'm a chronic pain medicine physician. I treat patients with chronic pain, either chronic non-cancer pain or cancer pain as a specialty.
Tom says Dr. Sitzman diagnosed the problem immediately.
A combination of neuropathy from damaged disc and from onset type 2 diabetes.
Dr. Sitzman prescribed a fairly new pain medication called Lyrica.
Almost immediately, the pain was gone.
After a year of constant use, Tom went to fill his prescription one day, but his insurance provider denied him, saying they would no longer cover the drug without prior authorization from his doctor.
As a physician, I'm being told now I must have authorization to fill this prescription. The pharmacist, I must obtain authorization for my patient in order to fill their medication.
Over a period of 2 months, it took Sanders Pharmacy 12 attempts and several exchanges between his doctor and the company to get his prescription covered again. During that time, Sanders paid for the medicine out of his pocket.
Patients should not have to decide between their next meal and their medications.
This is a growing concern among many doctors.
Patients that are on certain medications specific to their pain, they're being denied access to these medications strictly for economic purposes. The economics are that the insurance companies, some managed care corporations are limiting access to high-dollar or newer pharmaceutical medications that work for patients with chronic pain.
Sitzman calls this an access to care barrier.
Because these individuals can no longer afford the medications that keep them out of the emergency room, that keep them out of the physician's offices, that allow them to lead more functional lifestyles. That's my goal, and that's the goal of the medications.
But when those medications are being restricted for purely economic purposes, that's an issue that Dr. Sitzman feels should be addressed.
And the decisions are based on economics, not on direct patient care or effectiveness of therapies. And what's going on with me and my patient is being multiplied millions of times around the country at the cost savings of these corporations of hundreds of millions of dollars.